I'm Christy Moore, DHEC Chief Communications Officer, and I'll be facilitating today's briefing with Dr. Linda Bell, State Epidemiologist, and Nick Davidson, Senior Deputy for Public Health. Dr. Bell will provide a brief update, followed by a segment of questions. Before we begin, I would like to remind everyone to please remain on mute. Dr. Bell, I'll turn it over to you for today's update.
Yes, thank you, Christy, and good afternoon, everyone. I'm proud to say that yesterday, DHEC announced a new pilot program that's underway to help bring vaccine to our state's homebound individuals. Through a partnership with Agape Care Group, the homebound individuals in Hampton and Jasper counties who are currently eligible to receive their vaccine can make an appointment to have a registered nurse or a licensed practical nurse visit their home and administer the Moderna vaccine. The nurse will return in 28 days to administer the second dose, and after both shots are given, the nurse will stay to monitor the individual for 15 minutes, which is the standard monitoring period for all individuals who are vaccinated. Right now, this homebound program is only available in Hampton and Jasper counties. We hope to learn from this initial rollout, and we then hope to expand it across the state. The South Carolina Emergency Management Division is key in helping DHEC to bridge this partnership with the Agape Care Group. And having this pilot program roll out is just a prime example of how valuable partnerships are. Whether it's between government agencies or private businesses, we're all working together to end this pandemic. We look forward to additional partnerships to bring the vaccination effort to everyone who desires to be vaccinated in our counties. And as we've mentioned numerous times, DHEC is dedicated to ensuring the fair and equitable access to the vaccines, especially now that doses are limited and in South Carolina as well as across the country. We're committed to making the best use of the limited supply for those who are at highest risk first. And in addition to this new program, we're making sure that homebound individuals can easily get their shots. And I'd like to spotlight the efforts of our DHEC regional teams for making this possible, and public health workers who are committed to making vaccine clinics available in our rural communities. And of the 204 vaccine clinics that DHEC has held this month alone, and so this is the more than 200 clinics, 113 of those clinics were held in predominantly rural clinics. This means that of the 26,039 doses administered at DHEC clinics in February, a total of 15,107 of those were made available in our state's rural regions. That's more than half of all the doses administered by DHEC have been administered in our rural areas. So I just want to draw attention to these efforts and commend our regional teams and our dedicated workers at our health departments who are helping to set up these clinics and who are working at our state's local level to make this possible, along with our local elected officials and numerous community partners. One agency, one group, or one person isn't going to be able to stop this pandemic alone. It relies heavily on a network of strong and productive partnerships. Community support at the local level is vital to our success. And in addition to that, messaging across the board is vital so that all are aware of the efforts that are being made and all are aware of the resources that are available in their areas. It's also important that trusted local community officials, local leaders are also aware of these efforts and are connected to this network and assist us in working in partnership to make resources available in their communities. And so we rely heavily on these partnerships. We're very indebted to all of those who are committed to making this happen. And we believe that this will contribute to our continued success in making vaccines available, particularly in areas that are hard to reach. And so with that, Christy, that's my update, and I'm happy to address questions along with Nick Davidson this afternoon. Thank you.
Thank you, Dr. Bell. And at this time, you and Nick Davidson will answer questions that we have received. And the first several are actually for Nick. Nick, regarding the new DHEC pilot program to help bring COVID-19 vaccines to homebound phase 1A people in Hampton and Jasper counties, as the agency works to expand that program statewide, will other hospice providers join the initiative, or will it just be Agape?
Sure, thanks. The We are interested in home health and hospice providers reaching out to us. We're doing some of our own reach outs as well. But no, this will definitely we aim to expand this beyond just Agape. They appear to be a very interested partner thus far, and we have actually established an email address to which entities, home health and hospice providers specifically, could identify themselves to us, let us know that they're interested in doing a similar thing, being able to visit the homebound. So that email address, we can provide that afterwards, but it's COVID provider enrollment, all one word, at dhec.sc.gov. So we'll be definitely looking to hear from others who are interested.
Thank you, Nick. And I just dropped that into our chat feature for our media members. So is DHEC contracting with the providers who are joining the homebound program? Nick?
Yes, sorry.
Did you hear me? I said, is DHEC contracting with the providers who are joining the homebound program?
Thanks. I know we all have a boss, and when your boss walks in the room, try to listen to him. So my apologies there. But no, we are currently not contracting with Agape. As this pilot progresses, and we can hopefully expand it to other areas of the state and other providers, we may look at contracting with providers to kind of ensure that we have a rapid deployment of vaccine. But right now, we are not yet doing that.
Johnson & Johnson says it's ready to ship 4 million doses immediately upon getting their EUA. How many of those doses is South Carolina preparing now to receive? And how long could it take after the EUA for the doses to arrive in the state?
Sure. I do want to stress we do have some preliminary information, but it is just that, very preliminary. We are under the understanding that our first week delivery will probably be in the neighborhood of 40,000 doses. Those would be first doses that would come to us in the first week of shipment. We don't yet know what that first week will be. However, we have to wait for the EUA, and there's meetings today, the FDA meetings today, to discuss that EUA. And so I am hopeful that maybe at some point through the weekend or into next week that we will hear the outcome of that. And so only at that point in time, though, will we be able to place the order for what we're hoping would be for the first week about 40,000 doses. And once we place the order, it's a very quick process. Like all of the doses, it'll take several days, and we'll have it in hand and distributing it to providers. But we aren't able to do that yet. We don't know a definitive number, and we don't yet know a definitive date. So I'm telling you what I know, but there's much to still learn and be determined.
And has there been any thought into how a distribution plan would be initiated with the J&J potentially added to the mix?
Yes, we are actually actively working on what that distribution plan would look like. We understand this is a different vaccine with, it's just a one-dose vaccine. It's very effective, but it is a different vaccine. And so we hope to provide as much choice to individuals as possible. So we want to distribute this as widely as possible around the state. It will be limited because of supply, because of quantity at the beginning. So it won't be able to be everywhere right away. But it is definitely our plan to try to spread it in a diffuse manner so that it can be an option for as many people as possible.
And what is the cause of South Carolina seemingly being behind in phases compared to other states, especially our neighbors of Georgia and North Carolina? Given that all the states experienced a shortage in vaccine allocation, what can the slower rollout be attributed to?
Sure. I want to be clear that we are focusing, we continue to focus, we will continue to focus on those who are most at risk, very clearly. We want to prevent illness and death in our state. And so we do receive an amount that is based on a per capita allocation from the feds, from the federal government and the manufacturers, just like all other states. And so there's no doubt you could survey many, many states, and I'm sure many of the folks on this call have, and see that the variety is tremendous as far as what stages people are in and what individuals are included in those stages. And certainly I communicate probably most frequently with some of our Southeastern partners. And I've been doing that over the past, well, I do that frequently, but over the past week, I've been particularly interested in that. And so, we have some states in the Southeast, and I'm just looking over at my notes that I've jotted to myself yesterday, and some states that are doing 65 and older with first responders, another that's doing 60 and essential, another that's doing 65 and essential, another that's just doing 65 plus critical government workers and teachers. So it is a wide variety that is across the entire nation, and every state is a little bit different, and every state has to react to that, certainly. And so we're very seriously considering the next steps, and for us, the biggest indicator is how quickly are our clinics filling and to what extent are they filling. As we have to balance, certainly, the struggle to get a vaccine, the struggle to be able to get an appointment have we opened it up to enough individuals? So as we begin to hear routinely that providers aren't filling or aren't filling completely their clinics, we will expand. We do believe we're very close to that. We hear that many people, though, are still having great difficulty in finding a clinic, finding a vaccination opportunity for themselves. So we need to be able to continue to strike that balance. We're finalizing 1B plans now, and exactly what that will look like, and we do anticipate rolling that out in the very near future.
And can you comment on the high population of older people in South Carolina in regards to the rollout? Is this why we remain in the early phases of the plan? Is it because we have more people in those phases than in other states?
Sure. Well, there's no doubt that South Carolina has a large retiree population and a large proportion just in general that are 65 and older. But I think I would almost look back to my previous answer there as well. Is we're not behind. We're doing what South Carolina needs, and what that need is right now is that balance between, and it's a delicate balance between ensuring that people can get what they need and want, and also making it available to enough individuals.
And can you speak to the fact that phases are guidelines and not actual enforceable rules? And what problems or maybe solutions can this open up?
Sure. Indeed, that is definitely the case that DHEC, South Carolina, has not instituted a public health order or something like that saying, thou shalt. I think very clearly, as we have heard and looked into cases where we have heard that individuals may have received a vaccine at a time or in a phase that they may not have been qualified for, those instances have been very few and far between, and where we've reached out, it seems to largely be anecdotal in nature. And I would say too that from time to time, because we don't want wastage, there will be instances where we should, if there's 2 doses left in a vial, we have said that we would rather see those vaccines not be wasted and given to a person who needs it and eventually will get it, and who wants it, and that's a better solution than wasting it. So, I think our evidence shows thus far that trusting our provider community to be able to do the right thing, because we're all in this together, has been very successful. And I would rather do that and maybe even occasionally know that a one or two here get the vaccine, uh, and we're not intended to in that phase. So great cooperation from providers. I have not yet seen the need to make it an enforceable instance where penalties or something like that would be issued. I know that that's been done in other states, and we just haven't seen the need to do that yet.
Thank you, Nick. The next set of questions is actually for Dr. Bell. Dr. Bell, the first question, new research from the UK shows one dose of Pfizer provides protection for those who have already recovered from the virus. Is there any discussion about limiting those who have recovered to one dose?
Well, the Pfizer received emergency use authorization from the FDA to administer those doses on the schedule that was based on the research and the evidence that they submitted showing that the doses or that the dosing schedule was had been established to be safe and effective. And so unless Pfizer submits additional information to the Food and Drug Administration for approval to make changes in how those doses are authorized to be used, how that product is authorized to be used, we won't depart from that. So the researchers and we continue to rely on obtaining new evidence and information about the development of immunity. But unless the product is actually authorized by the FDA to be used differently than the way it was approved to be used, we will continue to adhere to the 2-dose schedule for that product.
And is there any new information on how long immunity lasts for those who have recovered? Is it still 3 months?
Well, we're still using that 3-month time period for evidence of immunity, and that's based on information that we collect on rare instances of reinfection. So at this time, there are a few instances of people being reinfected or developing illness inside that 90-day period. And so we are then making the assumption that they have some presumed immunity for about 90 days. So this is what we're basing that on. We're making recommendations that if someone has natural infection, that they would not have to quarantine if they should be exposed again within that 90 days based on that presumed immunity for 90 days.
And is DHEC reaching out to community leaders and local churches to help with vaccine distribution? There are many across the state willing to participate as much as they can. If so, how many have reached out to you and what is in the works?
Well, yes, we're doing a great deal of outreach with community-based organizations, and we are making great partnerships to bring services to the communities. Just looking at a couple of notes of the number of partners that we have, I can comment on that, but in this outreach, we have done numerous telebriefings, webinars to work with community-based organizations to inform them about the latest recommendations for the vaccine, but also to inform them about services that are available. And I myself have done many of these webinars, telebriefings to continue to work with our partners and keep them informed. We also have a very strong partnership with the faith community, with multiple denominations, with multi-denominational organizations to help us communicate with communities through their faith leaders in their communities. And this has been a very vital, very important, and very effective partnership. Many of the churches are also assisting us in hosting service delivery in their communities, both testing and vaccination events through the churches, working with community-based organizations, working with providers in the communities. And so the faith-based organizations and church leaders have been very important. And we have worked with specific outreach organizations that work with specific populations that target African American groups or Latin Americans. And those are also very important partnerships because they communicate with these groups in a way that is culturally competent, that addresses their needs, that addresses their special concerns in their communities. So we have reached out in many ways, many examples, both through formal communications, informal communications, and also informing our partners who will spread those messages out for us. And we rely very heavily on the local trust in those community leaders to work with us in partnership.
Thank you, Dr. Bell. Nick, I've got a couple of questions for you. First one is, we'd like to know if there are any plans to set up FEMA mass vaccination sites in South Carolina, similar to what they are doing in Florida right now. Hey, Nick, are you with us?
I am. I was just slow at turning my camera on. Thank you. I apologize. Yes, we are aware of those efforts, and we are also we have been communicating with FEMA. They have provided us actually several different offers about ways things that could be conducted. Some of those offers involve DHEC providing, or excuse me, the state, our resources in our state providing significant assistance to that site. As well as potentially using some of the vaccine that South Carolina has. And so the way we have responded is we have some great providers in the state providing some great services, but it's based on the vaccine allocation that we have. So if FEMA is able to designate additional resources, being the vaccine, of course, and also the staffing resources for that site, we would love to have them here. And so we haven't heard back yet.
And how many doses did we receive this week? And is there indication, is there indication weekly allocations will be increasing from the federal government?
Yes. So the amount that we were told this week that we could order for delivery next week, and that's the most current information we have, so I figured that's what I would share, is it's a bit higher than it was this week. And so I can share that for next week, the first dose allocation is going to be for Pfizer 57,330 first doses, and Moderna 48,800. I think that equals, we tend to not add it up because we really care about what's going where, but I think that's 106,130 if my math is correct. And so that's about 8,000 higher than it was this week. And so that's great. We're encouraged by that. Right now, we're told that over the next several weeks, it will be approximately a level allocation. But frankly, each time we've been told that, it's sort of a baseline commitment. And so pretty much each week, with a couple exceptions, there's been some incremental increases. And so even without potential Johnson & Johnson vaccine or even the Janssen vaccine, we do anticipate continued increases in an incremental fashion in the coming weeks.
Thank you, Nick. At this time, we're going to open it up for live questions. I would ask for members of the media to raise your hand in Teams, and I will call on you. Judy, I see your hand is raised. Please ask your question.
Good afternoon, Chrissy. Thank you so much. A question for either Nick or Dr. Bell. Wondering about.
Hey, Judy, we can barely hear you. Can you speak up?
Is that better? Hold on one second.
A little bit better.
Is that better?
A little bit.
Is that better now? Okay.
Go ahead.
My car pulled up. I was saying a question for either Dr. Bell. We're getting so many questions regarding.
Judy, we may have to come back to you because you're very faint. We'll let you work on that for a minute. You there, Judy?
Can you hear me now?
A little bit. Dr. Bell, can you hear Judy?
No, I'm sorry. I can't hear the question at all.
You know what? I'll hang up, Chrissy, and I'm going to dial back in on that helps.
Sounds good. Emily, you've got a question?
Yes, so the governor just lifted the last call order and capacity restrictions for large gatherings. That'll go into effect Monday. What does DHEC think about this? Is it too soon?
let's see. There we go. And bring my camera up. Dr. Bell, I see your bubble flashing. If you prefer, feel free, but I'd be happy to answer it.
Well, I guess, Nick, we can tag team it. My only comment is that we will continue to recommend that individuals practice the measures that are recommended that we know prevent transmission. So regardless of what is allowed in the communities, we want people to be able to patronize businesses, to participate in social activities and whatnot. And what we've said all along is that there are safe ways to do certain activities as long as people practice those prevention measures. So regardless of any changes, it's important to note that we are on a downward, showing a downward trend of disease activity in the communities, but we still have a significant amount of a disease burden. And so if people continue to protect themselves with the careful and consistent use of masks, wearing those at all times when you're around other people, still must practice the physical distancing and avoiding groups where those safe practices are not in place, then we still have ways to protect ourselves, and we still must continue those measures. And so, Nick, I'm sure you'll have some comments as well.
Honestly, I don't think I do. That was well said. I think we'll stop it there.
Thank you, guys. Sam, you've got a question?
Yeah, thanks for your time, guys. Really quick clarification. For the nurses that are going to go into homes for the Homebound Senior program, are those Agape staff, or it's not DHEC staff, right?
That's correct. Those are Agape staff.
Thank you.
MK, you've got a question?
Yes, thank you. My question is just about nursing home visitation. Is there any estimation for when those can reopen to visitors without the special sort of limitations?
Nick, if you want me to take that one, I can.
Sure, that'd be great.
The nursing homes are following the CMS guidance, or they're expected to follow the CMS guidance. And so they've always been able to allow visitation following certain rules about, as long as there's not disease activity in the surrounding community that is higher than a 10% positivity rate. They must also be able to maintain infection prevention measures within the facility. They cannot have had new cases in their facilities, in residents or staff, within the past 2 weeks. And with those being the major constraints, the nursing homes can allow visitation if the community disease burden is less than 10% and they have the means to limit the duration of visitation. They have a safe place to hold those visitations within their facilities, and they're practicing those infection control measures. And they can have outdoor visitation, weather permitting, under slightly less stringent guidance. But it's important that they not allow the introduction of disease in those facilities that could bring rates back up again within disease transmission within the facility. So we are monitoring whether or not the facilities allow visitation when they can. And if that doesn't occur, our healthcare quality staff work with them directly to find out if all those parameters are met. If visitation is not allowed, what might be going on there that would lead to that.
Emily, you've got a question?
Yeah, I also wanted to ask, due to a drop in COVID testing demand, places like Prisma Health is changing their testing hours. Do we know why the demand is decreasing in the state?
This is Nick. I think what I think is worthy of note is that we have seen an easing of the case positivity rate, which would infer somewhat leveling or slightly lowering of disease rates in the community. We've seen some hospitalization rates beginning to level and decrease slightly. With that, I don't think it's unrealistic to probably expect somewhat of a lessening in demand, even though it may just be momentary in testing.
Lexi, you've got a question?
Hi, yes. My question is in regards to the new phases rolling out. I know there's talks of that, that's not going to be happening anytime soon. Well, maybe sometime soon. But what's your message to teachers who are concerned about getting the vaccine, especially as North Carolina started vaccinating teachers this week?
Dr. Bell, would you be able to talk a little bit about relative risk?
Yeah, sure. I can talk about, as Nick said, when we compare ourselves to other states, there is a complete patchwork across the country about who is being included in the various phases. But we, with regards to the teachers specifically, when they will be able to be vaccinated in the current stage that their current phase that they're included in, we do hope to be opening up the additional eligibility, and that teachers would be included along with other frontline workers when that does happen. But I think that maybe the point that Nick is asking me to make has to do with the evidence that we have about the risk in the classroom settings, that what we know from both CDC published data, from our own surveillance data showing that limited transmission occurs within the schools, is that schools are oftentimes a safer setting than in the surrounding community. So in schools that are able to enforce the routine use of masks, to enforce that physical distancing, then we're not seeing a higher risk for teachers. We do understand that there is some risk there. It's a risk that we all share in the community, but disease transmission in surrounding communities is what the concern is. Those classroom settings and school districts and schools themselves enforcing the prevention measures is what's actually giving us the data that shows that there is less transmission from staff to students, from students to staff in those settings that maintain those measures. And so we're balancing the science and the evidence of a lower risk there with allowing access to as many as who want to be vaccinated can be vaccinated as quickly as possible. But while the vaccine supply is limited, we're still focusing on those who work in settings where there's demonstrated higher risk based on reports of disease clusters, based on reports of ongoing transmission within those settings, is one of the reasons why we're weighing how quickly we can vaccinate everyone who wants to be vaccinated, yet still reaching those at highest risk first.
Mike, you've got a question from the Greenville News?
Yes, thank you. Readers are seeing the rates lower basically across the board, cases, deaths, etc. What message do you want them to hear in the full context of that, the good news and the bad news?
Well, when I see the downward trends from surges, I always worry about community perception and what that means, because that's when people begin to believe that the threat is no longer there. And as I've said earlier, that is simply not the case. We're encouraged by this downward trend, but it is exactly the perception that the threat is no longer there that drives the disease rates up again when people stop observing what they need to do to protect themselves. And so I have to say that I'm on the one hand encouraged by that, but I always worry that we don't miss the opportunity to continue to drive the disease rates down rather than take temporary measures to relax what we've been doing, which, if you look at our epidemiologic curves that are posted on our website, we see that time and time again, every time we experience a downward trend, we have the tendency to go back up again when we do not follow those preventive measures. And so I must continue to. The now is not the time to stop what you're doing on an individual basis, and things that we can do to keep our community safe will help us drive the disease rates downward and permanently hopeful as we also bring up our immunization rates.
Jessica, you've got a question?
Hi. Yes. So with Agave going to residents' homes to give the vaccine, do you have an estimate of how many people you are able to give the vaccine? And do you feel like you have enough staff to meet the demand of how many residents might be needing the vaccine?
Sure. And let me just be clear too that the the area where we're starting first, Hampton and Jasper, is a pilot. That will be a way for us to figure out, exactly how many people can be done by how many staff in what period of time. So a bit of that, frankly, is to be determined, just because it is a pilot, and that's the point of a pilot. And so the Agape has indicated that for the staff that they have and for the number of individuals they know about in Hampton and Jasper through a variety of different organizations and means, that they think it will take them a couple weeks, maybe a bit more, but approximately a couple weeks to take care of those individuals. That, again, is the point of the pilot, and so we will see. If it takes longer, that's good information for us, because that will help us be able to determine what kind of staffing that we, and when I say we, I really mean our providers who are reaching out to and who are reaching out to us, will need to be able to do it successfully. So we hope to learn a lot from the pilot.
Thank you, Nick. And I did, Jessica, drop the link to the release within the chat feature, and it does have the numbers of folks in Hampton and Jasper County there. We're gonna.
And let me also say too, I'm sorry, Christy, to cut you off there, but I think it's important to recognize too that it's not going. We know that there are likely people out there who are homebound that we don't know about, right? That as many wonderful home health and hospice and elder care organizations we have, I'm sure there's people that just fall through the cracks and we're not aware of. So we will also be able to, through our COVID information, our call information line, COVID information line, we'll be able, if people call there and they're in one of those service areas, we'll be able to make that referral, in this case to Agape, to be able to make sure that we can get out to those folks as well.
Perfect, Nick. Judy, let's try you again. Let's see what your question is.
Well, let's see. Can you guys hear me okay now?
Yes.
Is it better? Okay,
Yes.
wonderful.
Thank you.
Thank you for your patience. I had to switch phones. I just had one of the other reporters asked the question, but I wanted to follow up just quickly on the long-term care facilities to ask if the second round of shots had been completed. The last update I heard, they were about halfway through, and also on the new state system that DHEC is evaluating, if one of the features that you might be considering would be a wait list for people who are waiting for the next phase to start to go ahead and get registered.
Sure, I can address that. I don't have the exact numbers in front of me, but the first few days of next week should be the point at which the second visits will have been completed. Recall that's a 3-visit program to our nursing homes and assisted living facilities. And so that the third visits will be starting, and that essentially will be occurring throughout March, or probably through much of March at least. And so anyways, we're looking forward to that. What was the second part of the question?
I was wondering, Nick, about the new state system that you're
Oh,
considering as an
yes.
alternative, I guess I should say, to
Yeah.
VAMS, and whether one of the features might be a wait list to kind of pre-register people for the next phase to help expedite those appointments.
Right. Interestingly enough, VAMS does have a feature, which the feature that we're using in our health department clinics right now, CVAS, doesn't have, and that's a feature. It's called pre-registration. And what that means is that if we set aside certain requirements, in other words, I don't know, you have to be 65 years or older to get a vaccine. if we do that for future phases, it does have a capacity that would allow people to at least identify themselves to us so that we could see the numbers of individuals and even, what communities they live in for future phases. So it isn't, I see where you're going. It's not quite a wait list because it doesn't allow, and I shouldn't say, it is not a wait list because it doesn't allow you to say for a particular clinic or a particular provider that I would like a vaccine, please put me on your wait list. But it would allow us to gather information about those who qualify for future phases, and that way when we hit that phase, it would allow us to, for instance, push an email out to all those providers to say, go to this website and register, or check out our website to be able to find a provider near you, or whatever we wanted to say, frankly. So it's not quite a wait list, Judy, but it's certainly a useful function that has some similar functionality to that.
Thank you, Nick. Anyone else have a question?
Christy, I have one more if no one else has their hand raised.
Go ahead, Judy. I don't see any other hands raised.
Okay, thank you. Back to the long-term care facilities, I was wondering the other question with the follow-up, once the third round of visits is completed, the obvious question from family members is, will that trigger, regular visitation, which I think Dr. Bell has already addressed. But I'm wondering, the other issue is, just because the vaccines are being offered, doesn't mean everybody at the facility is accepting the offer. So do you have any data or indication about how much vaccine resistance we're seeing at those facilities among patients or staff?
Sure. It's the numbers that we have for facility is based on licensed and available beds in the facility. The numbers of residents goes up and down more than you might expect, actually. And so the numbers that we have is approximately, I'm rounding here, but approximately 44,000 licensed beds. And we know that not all of those beds are full. Some facilities just aren't full, but there's also some individuals that, have pulled their loved one out for a variety of reasons or whatever. So there's always available beds. I'm really actually quite pleased because when we look at the numbers, if you look on our website, we're closing in on 30,000 individuals being vaccinated. And if you assume that 44,000 beds are what we had out there, then and that a number of those clearly are not always full, even if you assume they were, we're already well over 65% vaccination rate. And so it's actually somewhat higher than that. So I realize I'm giving you estimates, but really, reasonably pleased with the numbers that we're seeing so far. And of course, we'll continue to be providing, even during that third visit, even though that's intended for second doses for individuals, if there's somebody in there who hasn't yet been vaccinated, maybe they're a new resident, maybe they changed their mind, and they now want a first dose, we'll give them that first dose, or CVS and Walgreens, our providers will give them that first dose, even on that third visit, despite the fact that that's, not really what it was intended for. But if we're there and have it and they want it, let's do it.
All right. Anyone else have any questions for today? All right. So for planning purposes, we will plan to hold another 45-minute briefing next Wednesday. And as a reminder, we're making changes to improve these media briefings for everyone. So each week, we're going to continue to hold 2 45-minute briefings on Wednesday and Friday. And this will give our experts more time to answer your questions like today. If you do have any follow-up questions, please send them to our COVID-19 Joint Information Center, and we'll work to get them answered for you. And in conclusion, I'd like to thank you all for your time and your dedication to share the latest updates about COVID-19 and our state's vaccine rollout with South Carolinians. And that concludes today's briefing. Thank you.